We have been reporting on this idea since last week when Governor Whitmer first asked the federal government to please surge more vaccine doses, extra vaccine to her state to help fight the spiking cases. Vaccinated people not only do they not get sick and do they not die from COVID, by and large, they don't get infected and they don't spread the virus either. A place that has out of control spread could really benefit from everybody getting vaccinated very quickly. In her call with President Biden to make that request for more doses for a second time last night, the president reportedly talked to Governor Whitmer about the federal government's plan to help Michigan better administer the doses that they've already got. He also reportedly said the federal government will help Michigan increase their testing capacity, which is important. The president reportedly told the governor that Michigan will get more personnel to help administer vaccines. They'll also get more therapeutics, more treatments for people who have COVID to keep them from getting very sick, to keep them from being hospitalized, to keep them from dying. But Jeff Zients, the coordinator of the White House Coronavirus Task Force, after he reiterated that part of the plan during today's COVID briefing, he stressed that there isn't going to be a surge vaccine program, that the White House will continue to distribute vaccines based on just population alone, at least for now, rather than surging extra vaccine to places that have bigger problems in transmission. When it comes to the brass tacks of how many doses delivered to Michigan actually wound up in people's arms, whether part of the problem is that Michigan is being somehow super inefficient with the doses that they've got, we crunched those numbers today, and if you use CDC data, it looks like Michigan is basically doing what everybody else is doing. They've given out about 76% of the doses they have received, and of course you'd like that to be 100%, but 76%, that's on par with the same figure nationwide. They're better than many other states. Michigan doesn't seem to be having a crisis right now because they're doing a particularly bad job administering vaccines. It just seems like they've got a ton of virus right now. Wouldn't a ton of extra vaccine help them? Joining us now is Dr. Farhan Bhatti. He's a family physician in Lansing, Michigan. He's the Michigan State lead for the Committee to Protect Medicare. Dr. Bhatti, it's a real pleasure and an honor to have you with us tonight. Thank you for taking time out of your busy practice.
Thank you. The pleasure's all mine. Thanks for having me.
Could you use more vaccine in your practice?
Absolutely. We could use more vaccines in our state. Look, I appreciate all the efforts that the Biden administration has undertaken to help Americans get to where we've gotten. They've instituted a national plan when we didn't have one before. But Michigan's hurting. And we're hurting for a lot of reasons that I'm sure we'll get into. But the federal government can do a lot more to help how many vaccines we're going to get week after week after week here. And if you don't know how many vaccines you're going to be getting, you can't schedule patients or people effectively. You can't schedule patients when you don't know when the vaccines are coming and how many you're going to get. So if the federal government were to give more to Michigan, if they were to surge our capacity, then entities across the state that are administering vaccines could scale up. I was talking to the health department director in my county, Linda Vale, earlier. She would love to be able to scale up our capacity. We can very quickly start immunizing people 12 hours a day, 7 days a week. But we can't do that if we don't know how many vaccines are coming our way. We need vaccines in our freezers and in our refrigerators so that all across the state we can schedule people as effectively and as efficiently as possible to get shots into arms as quickly as we can.
Do you think that Michigan is having a particular problem or sort of the same problem that everybody's having at the same level of vaccine uptake, of people actually having the option of taking the vaccine but not wanting to get it or not wanting to get it now? Is that dynamic the same in Michigan as you've been hearing from other physicians around the country, or is there anything special going on in your state?
What's happening in Michigan as far as the rise in cases is a perfect storm. Vaccine uptake is one of them. Another one is that we've got more B117 strain here compared to every other state in the country except for Florida. And we've got school districts that are open in person, many of them across the state. And while we don't think the kids are getting it in the classroom, they're certainly getting it at after-school activities and sporting events. And we've got mixed messaging coming from political leaders. We've got our Democratic governor, but we've got Republicans that lead the House and the Senate. And for the better part of the past year, they've been downplaying this. They've been parroting the Trump talking points. They've been telling people not to take it seriously, that health experts don't know what we're talking about. They showed up to the floor of the House and Senate without wearing masks just to spite the governor. And, unfortunately, the single biggest predictor about whether or not a person's going to get the vaccine is their political affiliation. 36% of all Republicans say that they're not going to get the vaccine ever. And that's compared to only 6% of Democrats. And I'm seeing that every day in my clinic. We're vaccinating people ourselves in my clinic. And the patients of mine who are conservative are much more likely to refuse. And we're spending a bunch of extra time talking to people about how the vaccines work, why they're safe, and why people should get them, and how we need to reach that 80% number to get to herd immunity. And sometimes I'm able to convince people, but sometimes it's very hard as an individual physician to compete with the things that they're hearing from elected officials that they look up to, or that news networks that they watch every day. They're hearing things that it's, that this isn't as big of a deal as we're making it out to be. It's hard to compete with that.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.